Do you suffer with neuropathy, nerve pain? Are you suffering with a dysautonomia? Your body has lost its ability to regulate its heart rate. If that's you, you deserve to watch this video, because this man right next to me, Mr. Joshua Peel, who comes to my clinic, I'm Dr. Herman, he comes to my clinic from West Virginia. Today was his 4th visit with me, which we started care October of 2018, and today is September 9th of 2019. And his nerve pain is 100% gone, and for many months, and his heart rate is down to a normal range, and we're going to talk more about that. So if you are dealing with any of these symptoms, continue to listen to this video, because you can get well, you deserve to get well, and I'm here to help you do it for yourself. So Mr. Peel, again, how long did you suffer with your pain before you came to me in October of last year?
This has been about a year now, but before that, I would say about 6 to 8 months, something like that. And just absolute severe pain. I know I talked about it before, but this is the worst pain I've ever felt. It's really hard to explain unless you've experienced it. It was so bad, I had trouble walking, couldn't walk. I laid down most of the days. I actually would, at my worst, I was getting around with a walker and a cane, going everywhere. Just hard to couldn't put any weight on my feet. I kind of walked with them at the sides, just nerve pain throughout my entire body. And yeah, I suffered with that. Also during that time, I was losing weight. I got down to about 145. My ideal weight range is like 180. So dropped a lot of weight and just really sick looking. Just bunch of other problems. Leaky bladder, just constipation, just countless issues with it. Yeah, that lasted. That was my life. No sleep, no sleep because of the pain, just the nerve pain. It was so many compounding issues. It's sitting here now. It's my friends and family who saw me go through it, who know, what happened, what I was feeling. They could see it in my face. They could see it in my body. They didn't know what to do. Nobody knew what to do. And coming here was, it was like a last ditch effort. This was where, should have went the first place. But absolutely say it's miraculous what's happening now. I've got, I've gained my weight back. I'm walking around. I'm able to put all the pressure on my feet. My feet are doing great. I can walk. Just being able to walk again is a miracle in itself. Without a cane, without limping, because I limped for the longest time too. Just progressively gotten better, and all of that's gone now. So
I love it.
Yeah.
And again, the severity 0 to 10. The 10 was a 10.
Absolutely.
A 10. And in one video that I'll merge into this, you're going to see, or I'll try to maybe take a cut here or take a break here and come back to our discussion, so you can actually see what it was like before when he walked, and he walked on the edge, right? You were walking on the outside of the feet, and you'll notice when he walked, his fingers were curling. If you pay attention to the video, you'll see him walking on the edge of his feet, and his fingers were curling because he was in such severe pain. And one thing you told me was that you had you covered up. You tried to cover up.
Yeah. Even that was hard to do. To walk around without support, putting weight on something, having somebody hold me. Something to note. Being in Fort Lauderdale, when it came down the first time, this is something else. Went down to the beach, and I, for the longest time, have only been able to walk on flat, hard surfaces. And even then, at that time, at my worst point, that was hard to do. There was I had so much. It's kind of hard to explain. It's so much feeling I could just feel everything. It was so hypersensitive in my feet. And I remember the first time coming down here, going to the beach, I couldn't do it. I walked out. It was almost like I could feel every grain of sand, and it was so bad. Halfway out, I had to literally, it's embarrassing, but I had to literally crawl back. I had to drop down and crawl back. Wow. The same with grass, any uneven surface. It was that bad, and now I'm able to go on the grass, and yeah.
Even with you coming here the first time, and your heart rate was, again, you had an elevated heart rate. What was it, about 130 beats a minute when you were sitting down?
Yeah, resting.
And that had been for 2 years.
Yes.
And so you took it upon yourself to fly here, even though the heart rate was severely elevated.
Yeah.
For a couple of years.
Yeah.
Because it was either do or die, basically.
Do or die. It really was.
And you still made it here, even though you got on the airplane and it was really stressful. The pain was severe. The heart rate was severely elevated. You still made it happen.
Made it happen.
Yeah.
I mean,
and it was one of the best decisions, as you told me.
Absolutely. Just, at that point, it, do or die, using that expression, I was so bad. I felt, I felt pretty close to death. I mean, I don't know how else to explain it. It was that bad. I know there are people out there that live, every day with pain, but until you're like in constant pain 24/7, you have no idea how bad it can be. But nothing was going to stop me from trying to get better myself. I wasn't going to let anything stop me, so I did what I had to get
and the
here.
Hospitals?
Yeah, the hospitals was a joke. I mean...
and the medications from the MDs?
Medications, they had me on Neurontin and some other things. I was on extreme doses of Neurontin just because my pain was so bad, and I kept going back, and they just kept increasing my Neurontin. I think I was taking 3,600 milligrams a day, and it wasn't doing anything. It wasn't doing anything.
And you felt like their answers and their tests, it wasn't like they just left you in a state of like, what is going on?
Yeah, I was completely in the dark. I was left completely in the dark.
And you said that you even think that they're
in the dark.
They're in the dark.
Yes. I mean, let's just be honest. They're in the dark about all there's just certain things that, they know to do, certain checklists of items they know to go down. And coming here, this has been, I got answers, a comprehensive list of what's going on with me, the real information that I was looking for. So, yeah.
How long did you have, if I may share with everybody, about your previous history, your previous issues that were going on ever since you were a little kid? I think you told me the constipation had been around for how many years in your life?
It was on and off for years. Yeah, I mean, it's just been
before your teens.
Yeah, and yeah, it's been going on for a while. It's never really regular. Until now, everything is going great. And when I was at my worst too, and I say when I was at my worst, I mean when I was 145 pounds, when I was pain every day, a 10, 24/7, couldn't sleep, just literally, just crying, just from, just not even, I mean, the pain itself, made me do it, but just living with it and no answer is just so frustrating. But at that point, I really, I may go once a week. My nerves, I felt like my nerves in my stomach were so tense. Everything is tense in my body. So this has been...
Once a week you're able to go to the bathroom?
Yes.
And now it's every day?
Yes, every day.
And there's no enemas?
No.
And there's no stool softeners?
No.
There's no medication?
No medication.
You're taking the remedies?
Yes.
These drops, and they're helping you fix everything?
Everything.
And now when it comes to the body pain, all that body pain was from top to bottom?
Top to bottom.
10, 24/7?
24/7.
And it's gone?
absolutely gone.
And in the last round, when you came back to me after your second protocol, you still had some heel pain.
Yes.
But the heel pain is now 100% gone.
Heel pain is 100% gone.
And
yes.
the only thing that remains is a bit of numbness that's in the toes, tips of your toes.
Right, and
That's
it's not impairing me to walk. I'm back to walking normal.
But
so.
that we're going to get under control. I know this round should be able to make a bigger difference in those toes, and even with still with the type 1 diabetes that we're dealing with here, because there is an understanding in conventional medicine literature by the American Diabetic Association that the brain controls the pancreas, and that when the brain is stressed by different infections and toxins, it causes pancreas dysregulation. We'll get into that in another video. Your family members and friends all in your community notice how much better you're doing now.
Absolutely.
And so you've been able to, and other people, they come up to you and they're just like, "How did you do it? What's you look like you were dying."
The ones that saw me, I mean, they would come to my place. They would see me that I couldn't work. I was laying in bed. I was just laying in bed, just in pain. I had to have somebody come over and help me. I mean, I couldn't function. Could not function. I can't stress that enough, that I could not function in society. And the family members and friends that actually saw me, they can't believe it. I mean, they can't believe what's happened within a year.
They're amazed by it.
Amazed.
And you've actually referred in your coach who saw you.
Yes.
When he saw you, he was just like, "How did that happen?"
How did it happen? Yeah.
You told him, and
he came right
sat
away.
in here, and he has now, which we'll make another video with him. He now has, and he's a middle-aged, later middle-aged man, but he has now. You told me today when I saw you.
Yeah.
He's
off his blood pressure medication.
Off his blood pressure medication.
And he had I guess restless legs syndrome. It would keep him up at night. He said he'd usually get like 2 hours of sleep, and now he's getting 7, 8 hours of sleep.
No more restless legs.
No more restless
insomnia.
Legs. He funny enough told me that for the first time in as long as he remember, he had a meeting to go to, and he overslept for the first time. So yeah, it was amazing.
Sleep.
Yeah.
Phenomenal. Thank you for that referral.
Yes.
And now you've got another family member coming. We'll show her at another time.
Yeah.
But I appreciate you for sharing those. So now you've been out of that intense severe pain for, you came to me in October, so it started about a month into that first protocol, right?
Yes.
Yeah.
Yes.
So we're looking at you're about 10, 11 months of zero pain in the body.
No pain.
The whole body pain has been gone for 10 or 11 months.
Yes.
Sustained relief without taking supplements, without medications, without any other additional help. The man is out of pain. He put 45 pounds of weight back on. He can now sleep through the night.
Yes.
You're able to work.
Yes.
You're able to go around in society. You're not dealing with the pain. There's no more depression. There's no more stress with this. And so we have sustained relief because we found what was causing his nerve pain. We found what was causing his dysautonomia or dysregulation of the autonomic nervous system. And this man is proof that when we have a different set of tools and skills and experience and knowledge, that we can actually get into that body and be able to find out what it is that's driving it, different infections and toxins that get into parts of the central nervous system and other organs of the body. And actually, when we remove these, you can improve and have lasting, sustained improvement. I'm going to tell you that there are people, and I'll ask you a question here, and then we'll be done. And I appreciate you for sharing this. Really, I appreciate you, because there are too many people who need to know that you can get better. So different people heal at different paces, and no matter how hard we try, one person can have a more complex condition than another person. It's just the way that it is. There are different pieces of a puzzle. Even though you have two people who have the exact same symptoms or very similar symptoms, you still have two different people who have different experiences in life, and there are different pieces of the puzzle that have to be put together to help reverse their riddle, their puzzle, their dilemma, their chronic condition. So while one person can start to feel relief within a month, it may take another person 3, 4, 5, 6 months and a couple of treatments to start feeling the difference in their function.
All I can say is I had no hope. I had no answers from anyone, and coming here and doing the protocol, there is nothing else that helped me. There's nothing else. There's no other answer than coming to see you help me. I mean, and save me. There's so, you know, it's you have to come and try. Yeah, I mean, just you have to try something, and this is the only thing that had helped me. I mean, that's pretty much. So,
it's different, and just have an open mind and be willing. And
it worked. In my friends and family who saw me go through this, who struggle, they know the truth, and this works.
So thank you for that. So again, you'll be able to get me those pictures.
Yes.
That your mom took of you,
Yeah.
so we can look at before when he struggled with these hot compresses and all these things that he was doing to try to alleviate the pain. And I'll put those up at this video as well. And I'm also going to make another video that I'll attach to this video, going over some of the findings that we've seen in the past couple of rounds, past couple of exams that I did not put into the first video that I filmed with him and his mother when they came back after his first protocol, where he had a dramatic change in his function. So look forward to that as well. I look forward to helping you. I thank you for watching this. I thank you for helping me make this video today and updating people so that they can see that somebody even into the future is still living without the pain. So I thank you for watching this video. I hope it was helpful. And if one person if there's one person who can find this beneficial, please share it with them.
Yes.
Parietal lobe, the right foot from the left parietal lobe. So we have nerve roots in here that extend all the way down to the end of the foot or the hand or parts of the body. So the parietal lobe is really important. Not the only part of the central nervous system or the brain that helps us feel or sense things. We have the thalamus of the brain that helps us sense and motor control. We have different parts of the brain that help us feel the body. But the parietal lobe is where all of the nerve roots stem from. So his parietal lobe also had tetanus bacteria in there. And he is now nearly 100% better from the treatment so far. Again, go back and watch the video again. I'll show you the thumbnail of the longer video of him and his mother in here with him after his first protocol of the incredible change. Now, before I get into, so let's tell you what I found with him today, because he's got still the rapid heart rate that we've got to get down to normal. Normal heart rate. I found that he had in his amygdala, the fear, panic, anxiety part of the brain. The amygdala, when it's stressed by infection, it makes heart rate go up. And it can make pain. And it can make other symptoms develop. He had the Zika virus. He had the California encephalitis virus. He had 3 kinds of candida infection. He had the infections from his teeth that were extracted in his amygdala. He had ringworm fungus affecting his amygdala, the influenza virus affecting it, chikungunya virus affecting his amygdala, Epstein-Barr virus affecting it, tick-borne encephalitis virus, and he had mercury affecting his amygdala, dental mercury that is. And I found another part of the brain called the cingulate gyrus that controls emotions, California encephalitis virus. And he will get so much better after this round. The body can recover, you can get better. Right now, I'm going to tell you that, as you can see, he's doing incredible. So you can call my clinic and become a patient with me and be able to overcome your symptoms of chronic disease, chronic pain. The clinic number is 954-370-3100. That's 954-370-3100. Or you can email my assistant and she will be able to get back to you. I'll put the email address up here as well.